A lot of times with weight loss, people yo-yo back and forth. They gain their weight back, they do calorie restriction. There are many things that people have tried in the past that maybe it worked, maybe it didn't. And if it did work, it's not long lasting. They're going to gain the weight back. You think you're eating less and you're going to lose more weight? No, you actually need to eat more nutrient-dense food.
Welcome to Mastery Podcast, where we share stories of impact-driven entrepreneurs to create that ripple effect of positivity. I am your host, Dr. Saz. Today we have with us Dr. Megan Pasookhush. And Dr. Megan, you're the founder of the Wellness Pharmacy in Cary, North Carolina, and you're also an expert in weight loss medicine and GLP-1 peptide. Is that correct?
That's correct.
And you have a lot of degree behind you. So she is fellowship trained. You are fellowship trained, board certified in anti-aging medicine, on top of being a clinical pharmacist practitioner, on top of running a pharmacy and doing a lot of stuff. So welcome, Dr. Megan.
Thank you, Dr. Saz. Great to be here. Thanks for having me.
Great to have you, and I'm sure we can talk all day about different stuff. We share a lot of similarities. We were both Thai. We were born in Thailand, from the same city in Chiang Mai.
Yes.
And we both moved here when we were 11, and we both are pharmacists, clinical pharmacists. I mean, when can you find this?
You're my long lost sister. I just found you.
Like, where have you been?
A month ago. No, right? 2 months ago I just found you.
Yeah. Well, it is so. I'm so happy you're in my life right now, and you motivated me a lot to look at things, especially in the healthcare arena, in a much more serious way now. I know I got away from healthcare a lot, and now. But I'm crazy about health, and now looking at wellness and people trying to lose weight and doing it all wrong, right? And that's why you come in. You help fill that gap for them. Now, can you explain how the weight loss program at Cary Wellness Pharmacy integrate GLP-1 peptide into the program?
Sure. So really and truly, going back to what we talked about with wellness and healthcare, really what we have right now is sick care. We have sick care everywhere. So I wanted to focus more on how to create change and how to make that long lasting. A lot of times with weight loss, people yo-yo back and forth. They gain their weight back, they do calorie restriction. There are many things that people have tried in the past that maybe it worked, maybe it didn't. And if it did work, it's not long lasting. They're going to gain the weight back. But there's so many things. The underlying cause of health goes so far beyond what we think is weight loss or an inability to lose weight. It's really inflammation, and it's really hormone imbalance. It's really lifestyle, nutrition. And when people say, I eat healthy, you don't really know what's healthy for you. Every single one of us is genetically different. Not a single one of us is alike. So we're not going to respond to the same method of weight loss that worked for somebody else. And so people do get very frustrated when they don't get a long-lasting result. So what we do different is we incorporate many tools. And because I've been in this space for a while, and my team, I do have a team with me, consists of a provider who has been in the hormone arena, optimizing hormone, which is a key factor in achieving longevity, in getting quality of life back in many of us women and also men. So we incorporate the right people in the team. We have health coaching, we have a nutritionist, a functional nutritionist, and we have a great team at the pharmacy, all of my pharmacy staff that will be supporting the client. So we incorporate GLP-1 as one of the tools. There are many other tools such as education, such as running the right lab. Because you really don't need to be guessing. You need to test. Right. And a lot of times it's really, frustrating to say, but when you do someone go and get their blood work at their conventional doctor or at an office, they don't really run a ton of markers, and you're missing so many things. So we are using all of those information and all of our knowledge, all of our support system to put the puzzle pieces together.
Right.
And yeah.
Right. Thank you for explaining that to me and our viewer out there. Now, why do you believe it is essential? And let's go back to weight loss, because people think they can just take the GLP-1 peptide and they're good
right.
to go, and then they just go eat whatever, right?
Right.
What is the reason to combine that with everything else that you do
right.
in the wellness pharmacy?
GLP-1 agonist, when it first came out, we've actually learned about it years ago in functional medicine, and actually it's been around because it was historically a drug that they were using for type 2 diabetes as a treatment, right? And at a higher dose, it was shown to reduce weight, and it impacted weight. And so then you have to connect the dot that the problem that many of us have, especially when you get older, is insulin resistance. And that is a culprit for so many things, just metabolic syndrome altogether. So that's going to be your cardiovascular health, lipid, and just in general, just dysbiosis of hormone imbalances, right? Thyroid, adrenal, everything all together. It's a key player because now that they have been using this for weight loss, it is helping people who didn't respond when they were doing other things. Because I've been in the hormone optimization arena for quite some time, and we've educated and we've worked with patients to help change their nutrition, their lifestyle, and those of us, especially ladies who are approaching perimenopause or menopause, right? It's really frustrating because you feel like you've done everything and it's just not moving that scale at all. And I feel the pain and that struggle. I'm going through it myself. And sometimes people look at, you may or may not be what they call as obese, but you're not your old self. So that's a reason enough to get your confidence back, to work on yourself. And the tool that we now have is this GLP-1, and research have shown, and we're learning more and more about it, because it is working by making your pancreas secrete more insulin, and it makes you more sensitive to insulin, especially in your skeletal muscles. So, it's really moving the needle for a lot of patients that thought they tried everything, and starving yourself and calorie restriction, it's not going to be something that people can do forever, like going on a diet that is actually not something sustainable, because you cannot eat, like that. If, let's just say, somebody wants to cut calories, they can't eat like that forever. Your body's starving. And the point is not to starve your body of nutrition, right? But to create a more optimized hormone just comprehensively, so that you see the scale, not just the scale. I don't want to say the scale, because really and truly you should be measuring your body.
The body composition, right?
The body composition, yeah.
Yeah, we have one of those scales at home. It measures the percentage of your body fat, percentage of your muscle, and water, and all those stuff. Plus, if you go to the clinic, right, there's other stuff that they measure, like your bone density and stuff like that.
Bone density, muscle mass, DEXA scan, so things like that. But just as simple as using a tape measure and just kind of measure your arms, different places on your abdomen, your thighs, you'll see that you'll lose inches, right? And maybe the scale's not moving as much because you're also doing other things to maintain muscle and to build muscle, because that's going to create more of a long-lasting benefit and result of weight loss.
Right.
So, yeah.
Yeah, because muscle mass is more heavy than fat. You're losing the fat and you're gaining the muscle. And the GLP-1 peptide will help with the long-term effect of that.
Yeah, so it helps people that you know, a lot of times when people come in and they want result. That's just how it is nowadays, right? They want quick fix. They want Band-Aid. They want to see it tomorrow. I take my medication today. I should be 1 pound less heavy in 3 days. That's what we want as a society, right? So it's like fast food. You know, you go and you get your stuff. But anyway, I won't talk about that. But yeah, this tool will actually help people see results faster as they're still working to incorporate in new things in their lifestyle change, the nutrition, all of that, and the hormone imbalance and optimization. We can work on all of that. And when people see result and when they see faster result, right? Oh, I have a beach trip coming up or whatever it is, graduation coming up, weddings and reunion, high school reunion coming up. They want to see a result fast. So if they see a result, right, within a pound a week is what we think is a safe amount of weight to lose. If they see a result in 2, 3, 4 weeks, they're gonna feel inspired and they're gonna feel like, oh, I can do this. Oh, I feel good again. I feel confident again. It's not just about the weight. It's about giving people the hope back, their life back, and their health back.
Right. Dr. Megan, can you share some success story of any of your patients that have been through this program?
You know, funny you brought that up because we've made everything we do is personalized, right, to the individual patient and client. One of my patients that has been with me for several years. We have already started working on nutrition, lifestyle, and hormone balance. So we've been doing that for at least a year, if not more than that. And she came to me, and she's a group fitness instructor, right? So she's active, lovely, lovely lady, and she's frustrated. Okay, it's just like the story I told earlier. Frustrated because the scale's not moving, the inches are not gone. She still doesn't feel like herself from far away.
She's a fitness instructor.
She's a fitness instructor, correct. So anyway, she started on the GLP-1. And she actually started on the sublingual version, which some people don't like to do the injections. So we do, like I said, customized approach. And we did the sublingual. She started that, and she came in yesterday. I haven't seen her. I think it's been 4 to 6 weeks, maybe 8. I don't know. Time flies. Hasn't been that long, less than 3 months. And she came in, and I looked at her, and I go, "You look really good." And she goes, "I know. I lost 20 inches.
Oh my gosh.
20 inches.
Dang.
Yes. Her arms look great. Her abdomen, she pulled up her shirt and she was like, look at this. And she's just so giddy and so happy. And it's like, I've never seen her like that before. And she almost cried because she said, "Thank you so much for showing me a way so that I can feel like myself again." And and I asked her, to do a video with me so that she can share her story with others, because she did everything. She did all the things that we asked her to do. She did all the things that we recommended for her to do so that she doesn't lose, muscle mass, because that's important. Right. And she ate right. She exercised. She did weight training. She's the epitome of like what all of our clients should get, the result that they should get. So she was, she told me that yesterday, and I ran into her yesterday. So it was truly a success story, and I will have a video of her to share.
Yeah, that'll be great to share with other people the story. Yeah. And that's the power of your program, because it incorporates so many things. It's not just the peptide, which the peptide is great, because that's the missing piece for many people.
Right. It's a key piece that is actually moving, some of the things that were static. But it's been great that we're able to use this now. And there are newer peptides that are supposed to be in the pipeline, because not everybody's going to respond. I mean, there's several. Actually, there are 2 of them out there right now, and not everyone is going to respond to one. Right? So then we go to the next. So there's a plan. That's what we have with our programs, because it's customizable. So if this doesn't work, then we move to the next thing, and then the next thing, and then the next thing.
Yeah.
Yeah.
Beautiful.
Yeah.
Thank you. And there are some, misconception out there about the peptide, right? The GLP-1 peptide. What are some of those misconceptions that you heard of?
Well, if you go on the FDA website, or if you look at the black box warning, they say something about thyroid cancer, which is actually, it is occurring only in rats. So it hasn't been shown in human, and I think it has to do with a syndrome that is genetically linked to some patients. Populations are predisposed to that, and it's very rare. So that's one. Another one is pancreatitis. The difference between medication and poison is the dose, right? And we know this from pharmacy. So you gotta, and everyone is different as far as their elimination system, their detoxification pathways. So you do need to look at the dose. You need to work with someone who knows how to dose you and how to hold your hand through this, so that you're not experiencing the side effect that I hear a lot of people are. A lot of people are getting. Is the more common ones are nausea and gastritis, and of course it's going to slow down your intestinal, the movement. So then there are tips that we tell our clients on what to do to avoid all of that. The misconception is, those side effects, and another misconception that we already discussed is people are expecting to see quick result right away. And I like to remind them that even in, the brand name, the studies, they're saying that you may not see result for 6 months. But a lot of our patients are seeing really good result when they're doing all the things.
Awesome. Great. Yeah. Thank you for that clarification.
Sure.
And Dr. Megan, what lifestyle and nutrition change that you found to be the most supportive for the long-term result?
The most important thing, hydration is really important, but also don't starve your body of nutrients, right? Because your body is going to do the negative feedback thing where it's going to outsmart you. You think you're eating less and you're going to lose more weight. No, you actually need to eat more nutrient-dense food. And another thing is to eat protein. Push protein, because we want to build muscle as you're also working out with weight-bearing exercises. And if you can't do that right away, just do body weight. So for a long-lasting result, is incorporating in actually really adopting a new lifestyle, a better and more improved lifestyle, and get rid of the food that is causing inflammation is another key, which is something that we can address as well, because in this day and age, a lot of people have gut permeability, or they call it leaky gut, right? And so they end up, a lot of the weight, I think the first 10 to 15 pounds of the weight that people lose is inflammation. So you need to identify what those foods are. And, there's a way that you can eliminate like the top 5, but you can also dial that in and let's test. What are you sensitive to? What you're sensitive to today might be different than what you're sensitive to in a year. So it's going to change as the time goes on, but at least it's the education piece, and it's also the empowerment piece that I love about our program, because when our clients understand why they're doing a certain thing, they understand it, it clicks, they I don't want them to need me forever. I want them to go and live their life. And if they move to another state or I move to another state, it's okay because I've given them the tools that they need to make this sustainable and to make this life-changing, get into the life-changing journey to wellness.
Yeah, thank you for that, Dr. Megan. Now, I know we're running out of time here. Is there any last thing you want to tell our viewer and listener about this weight loss and wellness journey that they want to embark on? What is your last wisdom?
Don't give up. If you're frustrated and if you've been struggling, there are people out there that can help you. And if you're not getting the result that you need, keep searching. You need to find somebody who's a good match to work with you. And when you put your mind to it, you can do anything.
Absolutely. Yeah. Thank you, Dr. Megan, for being here. And if you're in the area, which is North Carolina,
yeah.
Cary to be exact.
Yes.
Check out Dr. Megan's program. Is that?
So our website is carywellnessrx.com.
Mm-hmm.
You can go to our website and click on Start Now or request a consultation for weight loss. It's super easy to get started. My team is ready to help you. You can also call us. Our phone number is listed on there as well.
Awesome.
Yeah.
Great. Thank you so much, Dr. Megan,
for
being here.
Thank you for having me.
Thank you all for sticking till the end of the episode. And for those who are in search for wellness, I wish you well and strive for the best solution for you. And like Dr. Megan said, everybody is individual. Never give up. Check out Wellness Pharmacy
of Cary.
Dr. Sa signing off. See you in the next episode. Bye for now.